Welcome to the Pot of Inquiry, everyone. My guest today is Dr. Amit Lakkaraju. Dr. Lakkaraju is an interventional radiologist in Melbourne, Australia, and he has a dual-faceted practice. One is management of chronic pain, and the other is venous disease. Today, we're going to talk about his management of chronic pain, primarily through the use of stellate ganglion blocks, which is a very interesting modality and deals with the sympathetic nervous system. And there are seemingly more and more indications for this technique as time goes on. So we touch a little bit about CRPS and other conditions that can be addressed with stellate ganglion blocks. So please enjoy this conversation that I have with Dr. Amit Lakkaraju.
Welcome to the Pot of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours. Get down in the cave and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
All right, welcome to the Pot of Inquiry, everyone, the podcast for human optimization and understanding. I'd like to introduce my guest today, Amit Lakkaraju. Dr. Lakkaraju, did I pronounce that correctly?
You did, yes.
All right, very good. Well, thanks for joining us. Tell the folks where you're in practice. You're coming from way far away from us up here in Georgia right now.
That's correct. So I'm in down south in Melbourne on the other side of the world. So it's a beautiful Saturday morning around this side of the world. And so my practice, so I'm an interventional radiologist, and my practice is pretty much dual-faceted. I do chronic pain, interventional chronic pain, and I also manage venous disease, so lower limb venous disease is where my other passion lies.
Oh, we may have to go. We're going to talk about stellate ganglion blocks and pain a little bit today, but if we want to talk about venous, we can touch into that for sure. So, well, let's talk about stellate ganglion blocks, and I guess why don't you just tell everybody, just give us the basics, what they are. And how long has this been done? Just some background so we have a foundation.
So let's see. The stellate ganglion is a little nerve cluster that between the mainly around the C7 cervical vertebral body, and it's one of the major sympathetic network nodes that's in the body. So it's present on both sides. We know that it's seen to be involved a lot with trying to maintain homeostasis. The carotid arteries are right next to it. The vagus nerve runs quite close to it, and it can mediate things like blood flow, vasodilatation. It can also mediate to a certain extent pupillary constriction and dilatation, sweating on the head and neck region. But because it's a node for this sympathetic activity, it also has quite a lot of as yet poorly understood connections with sensory pathways in the head and neck region. So that's where the stellate ganglion has become a bit of a focus with a lot of this, with a lot of interventions that are around. Right. So yeah, that's where I sort of started my sort of line of inquiry, I suppose, to find out how we might be able to use the stellate ganglion in the setting of chronic pain.
So when we talk about chronic pain, one of the things that always comes to the top of the conversation is CRPS, and it's super complex. That's why it's called complex. But I mean, people who deal with it, you got to give them a lot of credit because it's not a very easy animal to handle. And
no.
So let's talk about. Go ahead.
Yeah, it takes a little bit of a little piece of you every time you deal with it, because the patients are so there's so much morbidity associated with it.
Right. Yeah, no, it's a crushing disease. And people who I guess people who are fortunate that never have to encounter it have no idea, practitioners as well as patients, just how much these folks suffer. And so how is it, what's your criteria for, let's say, the CRPS patient that comes into your practice? When do you start with this type of an intervention? Give me some of your thought processes on it.
Oh, okay. So it all started with one patient who came into my venous practice actually,
Okay.
who had a few veins on her leg, and then I took the deep dive into it and found out that she had had a surgical intervention on a big toe that started this whole process of chronic regional pain syndrome. That was 7 years ago. So she came in with debilitating foot pain and also wrist pain, lots of excessive sweating in those areas. The limb looked really quite swollen, pale, shiny, a lot of abnormal sensations over the surface of the foot. She was, I call it jangly. She just didn't like people touching her foot. Same thing was going on in her wrist. And then you looked into the psychosocial history, and she'd had history of abuse and secondary PTSD came out in this whole scenario. So we initially started treating her, and very quickly I found that, there was a significant sympathetic component to her pain that really wasn't really helping me manage her. So that's where I started using stellate ganglion blocks.
Okay.
And so that's where the discovery started, basically, of how the stellate ganglion is a big driver of pain, even in those who don't have CRPS, but do have anxiety, do have PTSD symptoms. Because I think that if you remember your neurochemistry around pain, we know that there is a downward push by things like the parasympathetics to reduce pain overall. But if the sympathetics are overactive, the parasympathetics get suppressed, and so your drivers of pain are so much more increased. It's basically like the amplifier in a stereo system. It just bang, 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 bang. So
Right.
you really need to tone it down. And that's where I think stellate ganglion blocks come in and are useful.
So let me ask you a couple questions, because that brings a couple questions to mind. But there seems to be a very high association with folks that have had sexual abuse and then develop chronic pain. One of my friends and colleagues is a gentleman named Forrest Tennant, and he was the editor emeritus of Practical Pain Management, and brilliant guy. And he always talked about, if you really dig down in the history of these chronic pain patients, primarily females, you can sometimes come up with a history where they have been sexually abused. And there seems to be this overlay. It's very interesting that you mentioned that, because when I was doing my research to interview you for this show, it indicates that PTSD is one of the indications for stellate peripheral or a stellate ganglion block.
Yes.
So I have a little bit of difficulty understanding how something that's given, albeit it's still within the central nervous system, but it is peripheral from the brain, how that could help the brain with these folks that have PTSD.
Yeah, so I think one of the things that we know with any huge emotion, whether it's whether it's a flight or a fight scenario, is that we all have this adrenaline surge.
Right.
We all have facial flushing. We all have sweating. We become dry. That's borne out with the vasovagal too.
Okay.
So if you take that as the result of a external influence, then I suppose the chips start falling into place about how sympathetic blocks start helping in this sort of scenario. All I would say is that PTSD, from whatever reason it comes from, is basically a recurring emotional response.
Okay.
So if you've got that, it's not as simple as that. Please forgive me for saying that it's an emotional response, but at a neurochemical level is what I'm trying to say, is that that the emotional reminders of all those traumatic events is a big driver for these sympathetic reactions that you find, the flushing, the sweating, all of those sort of things. So if there is a way of reducing that, then we're probably going to be able to have a positive impact on reducing the overall effect of that emotional response to that traumatic memory. That's how I see it. So when you do the sympathetic blocks, you actually reduce the overall sympathetic outcomes from those memories, and that has a positive impact
Feedback.
on a feedback loop, correct?
Okay.
On those areas, I think, on those memories, and that's where the PTSD seems to really benefit from stellate ganglion blocks.
So for me to kind of unpack that a little bit, by putting the agent in around the stellate ganglion, you're basically decreasing the sympathetic tone and maybe letting the vagal parasympathetic tone come back a little bit more, and then that decreases the feedback to the brain, so the patient feels less, for lack of a better word, emotional. Let's call it, maybe it's an anxiety component or whatever. Is that a way to look at it?
That's absolutely right.
Okay.
That feedback loop is a vicious loop. So when you break that feedback loop, you then start having a suppressive effect on some of those traumatic events and memories.
So that's kind of similar to maybe what some of the psychedelics are doing for depression, breaking up these default mode networks and stopping this constant rumination.
That's exactly right. So the basic tenet of any chronic pain is that it is a feedback loop, and anything that can break that feedback loop is helpful in reducing the overall burden or experience of chronic pain. And so that feeds back to this scenario.
So if we have a stellate ganglion on each side that we do, and let's say, I would think that the predominance would be that you would block the side that is affected. But
yes,
if
correct.
they have, let's say they have just PTSD without chronic pain, do you have to block both sides for this?
Yes. My feeling is that you can't block one side and unbalance everything.
Okay.
Some people, I know that there is a little bit of research showing that right-sided stellate ganglion blocks can be slightly more effective than left-sided stellate ganglion blocks. But in practical terms, we're in homeostasis. We've got two of these structures.
Right.
We should really be trying to deal with both sides.
Did you say that the right side is more predominant or more dominant?
Some people have said that they have found that right-sided stellate ganglion blocks can be a little bit more effective at reducing some of the symptoms. But equally, I'm not 100% convinced that that is the case.
I would wonder why that would be, unless maybe they're right hand dominant or something, or,
That could well be that there is a dominance, a brain dominance, and therefore you get a sympathetic dominance. I don't know. We certainly haven't driven into how the sidedness changes anything, and I certainly don't know enough about that side of things to really give a good opinion about it.
Well, in this type of thing, there's still so much undiscovered territory. These are new frontiers, neurochemistry, and as much as everyone's studied the brain and everything, it's like one of the true physiological frontiers that we've yet to really get into and really understand. When you start looking at neurophysiology, it humbles you very quickly.
Very much so. Very much so.
It's like, wow, so much stuff going on.
Yep.
All right, so let's talk about the actual block itself, because I think that's kind of interesting as well. A couple of questions there. What's the most common agent that you're using for the block?
Okay. There will be a lot of people who will fall back off their seats because I use 5% dextrose.
I love that, because we do a lot of glucopuncture. We do a lot of hydrodissections with D5W, and it's unbelievable,
That's correct.
Yeah.
And again, it comes back to, patient one. So this lady was exceptionally sensitive to lignocaine, so much so that when I started doing peripheral nerve blocks on this lady, she started to get systemic toxicity from lignocaine.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen. Hey Spelunkers, We're thrilled to kick off Season 6 with a fresh new look and the most exciting content we've ever delivered. This season, we're diving deep into the fascinating world of human optimization and understanding. But wait, there's more. We're giving back to our loyal listeners with an exclusive giveaway each and every episode of Season 6. That's right, prizes are waiting just for you. So how can you join in on this fun? Well, it's simple. Follow us on Facebook, Instagram, and LinkedIn. Subscribe to our YouTube channel, and here's the magic touch. Comment, "Let's Spelunk" on any of our Season 6 YouTube videos to enter. Of course, please add anything else you'd like to your review. Don't miss your chance to explore, learn, and win with the Pod of Inquiry. Let's spelunk into the wonders of Season 6 together. Wow.
So very quickly, I had to find a replacement to, 1% lignocaine. She basically had tonic clonics on my table when I was doing with 5 mils of 1% lignocaine. That was the level of sensitivity that she had. So then I had to try and then work out what to do with her. At that time, I just started going into the D5W rabbit hole.
Right.
And seeing how effective it was. I've been, one of the seminal moments in my career has been going to the Interventional Orthobiologics Foundation meeting that was held in Arizona in 2024. It's sort of been a major change in my practice. And one of the things that came out was how effective prolotherapy and 5% dextrose was. So in her case, I started using 5% dextrose. So we did three sets of stellate ganglion blocks 2 weeks apart with 5% dextrose. And it was very effective in managing her overall burden of pain.
What kind of volume were you infiltrating?
Anywhere up to about 5 mils to 7 mils.
Okay.
And because she was tolerating it so well, I was doing bilaterals. Because the vagus nerve was right next to it, I also started doing vagal nerve hydrodissections at the same time. So we did a sympathetic and a parasympathetic block simultaneously.
Wow.
And she seemed to get quite a significant amount of improvement of her overall feeling of, pain and stuff like that. And her PTSD symptoms, her anxiety symptoms also flattened out. And then I went on to start doing it in a number of other cases. So I had one lady who had burning mouth syndrome and secondary multiple facial syndromes, facial pain, basically, who I did 3 sets of stellate ganglion blocks with 5% dextrose. Really effective in reducing her orofacial pain. So she went from a 8 out of 10 most days and on high doses of various meds down to a 1 to 2 out of 10.
Wow.
I had another lady who'd had thyroid cancer, had a thyroidectomy, lots of radiation as a result of it. And one of her symptoms was that she couldn't swallow or yawn. So we did stellate ganglion blocks, in addition to the fact that she was highly anxious. So we did stellate ganglion blocks and vagal nerve blocks. After 3 sessions, 2 weeks apart, came back saying, I can actually now yawn, I can swallow food. She wasn't able to lie down and swallow after those blocks and the vagal nerve blocks. We also did a bit of hydrodissection of her esophagus under ultrasound guidance.
Wow.
Using 5% dextrose, because you can see the esophagus in your field of view on ultrasound. So she was able to do a lot of those sort of things. Another patient PTSD, quite a lot of chronic buttock pain, sciatica symptoms, low back pain, but highly anxious. Again, 3 sets of 5% dextrose, significantly improved.
So I've got a question for you because it's very interesting. In about 2017, we made an accidental discovery where we had a patient that came in with a common peroneal nerve palsy and chronic pain. And I told my nerve fellow, give her a peripheral nerve block to see if we can knock the pain down a little bit. And if we can, and she had had this condition for like 5 years. So we had no ideation that we would be able to help her from a muscular reinnervation standpoint. But so he gave her about a cc of just lidocaine, 1% plain, and ultrasound guided right next to the common peroneal nerve. And in 4 to 5 minutes, she had full motor strength. She could dorsiflex her foot. And we thought, wow, this is a vasodilatory phenomena, because we know when we have a focal nerve compression, that's going to cause an ischemia of the nerve, the epineurium in that area. And so we did a study where we compared the lidocaine to papaverine, as you know, a very long-standing, well-documented vasodilator, and we found the same phenomena with the papaverine. So we made the conclusion that this effect, which we named the Phoenix sign, and we just got one article published in November, I think, of last year in BMC, musculoskeletal, where we demonstrated with the papaverine that it did do the job. So we felt that the hypothesis was very dialed in. A nerve that's pinched is ischemic. We're going to get a better blood flow for a temporary period of time. And then we discovered just recently that D5W does the same thing. And we're actually doing a study now to see, and the D5W, in that particular application, you don't have to use any ultrasound guidance. You can just put it subcutaneously, and you don't have to worry about volume. If you put too much local in, you're going to get a drop. But we were using like 0.3 of a cc of Lido, so that never occurred. But the glucose at 5% or dextrose at 5% did the same thing. So we're kind of having to shape our hypothesis a little bit differently now, and kind of think about, well, maybe it's a bioenergetic phenomena. This nerve, when you have a focal peripheral nerve entrapment, it impairs, mitochondrial function as far as glucose metabolism. I mean, that makes sense and everything. How do you explain it, though, for the stellate ganglion? Because that's not a site of focal entrapment, is it?
No. Well, I wouldn't. Here's the question to you, I suppose. Whenever you have patients who have chronic pain, is there a neuroinflammatory component to pain?
I believe there is.
If there is a neuroinflammatory component to pain, then you then have to work out whether there is a fibrotic process to pain, because chronic inflammation invariably leads to fibrosis.
Right. On a microscopic level, right?
On a microscopic level.
Yeah.
And so I put it to you that if we have a structure that is neuroinflamed, then there is, and chronic neuroinflamed, then there is a degree of, to put it in a layman's term, scarring, and therefore there is a potential for impingement. The other thing to say is that the whole of the nervous system runs on glucose.
Right.
So, and then the third thing to say is that there is a mechanical component to these nerves. That they're not stuck down. They move like everything else in some form or another. So if you take those things into consideration, then with D5W, you are improving the nutrition of that nerve.
Right.
B, you are mechanically releasing that nerve. and C, you are also trying to improve the actual neurochemistry by allowing more normal neural, electrical activity through that nerve there by using 5% dextrose. It's not especially hypertonic compared to, say, 10 or 15% dextrose.
Right. Which you would not want to use around that structure at
No.
all.
Right.
I think there's some confusion in this world too when people talk about prolotherapy versus just perineural infiltration of D5W. And it's an important distinction in my mind, at least, because prolo means to proliferate, and you're trying to actually get some scar tissue. So you have a hypertonic solution, you're going to damage that a little bit. And it's fine for a musculoskeletal, like a ligament that's lax or something like that. I get that. But the last thing you would want would be, that around a major peripheral nerve or stellate ganglion and that.
Correct.
Now, let me ask you this. Is D5W safer in this application?
Oh, absolutely.
Yeah.
On so many levels. On so many levels. So the first thing is that you do have muscles. You've got the sternocleidomastoid muscle that you have to traverse or go past in some form or other. You've got your strap muscles, your longus colli muscles. So if you use 1% lignocaine or any of those sort of solutions, then inadvertent puncture of these muscles and injection will invariably give rise to issues there. The other thing is obviously you've got your arteries, your vertebral artery and your carotid artery. Inadvertent systemic infiltration, and you've got a patient who is, having an apoplectic fit on your table or going into VTAC or something along those lines.
Right.
So I think that from that point of view, it's much more effective to use something that is essentially, sugar water.
Right.
So it makes life easier.
You can put bags of it into the circulation and not hurt the patient.
That's exactly right.
Right. Yeah. No, it's got a wonderful safety profile. I've never had an adverse event with D5W. So I'm a big fan of that. All right. So you mentioned earlier that you would do them pretty much bilaterally most of the time.
Correct.
Now, would that be different with the D5 versus the lignocaine that you're using?
I think with lignocaine, say for example, I was specifically asked to use lignocaine, I'd be a lot more cautious about doing a bilateral stellate ganglion block. I mean, one of the endpoints of the stellate ganglion block is the Horner syndrome,
the droopy eyelid. Yeah.
The drooping, the facial flushing, the meiosis. And you see that a lot more when you're using sort of 1% lignocaine or one of those sort of substances. You also see it with patients who have had 5% dextrose too. But the degree isn't as much, I don't think. And my feeling is that it's actually, there may be a mechanical component to the Horner syndrome.
Okay.
It may be a mechanical stimulation of that, the stellate ganglion, rather than just a chemical stimulation or chemical blocking of that ganglion.
Now, with your administration of D5 versus lignocaine, do you find the same duration benefit or more or less?
I tend to find more.
Okay.
I feel that it gives it more. Often the stellate ganglion blocks are part of the whole treatment protocol that I use.
Right.
In my chronic pain practice, what I've found is that you're better off stacking treatments together.
Hmm.
rather than doing one thing, waiting for an effect, and if that doesn't sort of work out, then you go for something else. So I'm a big believer in throwing the kitchen sink at the patient,
Right.
because I've got one shot.
Right.
Psychologically, in a patient who has had chronic pain and is invariably 90% of these people are doctor shoppers in one form or another.
Right.
So if you're going to get a meaningful result out of this and give them not just 6 weeks of improvement, but many months of improvement, you've got to do everything. As a surgeon, you would know that,
Right.
when you do surgery, you don't just do one thing, you're doing multiple things. When you're doing a fusion of a cervical spine, you're not just fusing a segment, you're also looking at the other structures, the whole spinal unit. You're trying to do localized rhizotomies of the facet joints. You're,
Right.
making sure that you don't have post-operative scarring. Similar sort of scenario, you have to use multiple techniques at that time, a multi-target, multi-modality approach. And that's why I don't use stellate ganglions in on their own. It's
Right.
usually part of the whole process.
Right. No, and the more complex the pain is, the more you have to approach it that way. And now, a message from our sponsor. Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to the health of so many bodily functions, not the least of which is cardioprotection. If you have any question on nitric oxide, I suggest that you register with Approved Medical Solutions and begin receiving their educational emails. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, Approved Medical Solutions created the only nitric oxide replenishment formula without oxalates. Approved Medical Solutions does not use beet, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you'll receive a 10% medical discount savings. You can register to receive educational emails without any purchase. For licensed practitioners, you too can go to approvedmedicalsolutions.com and get registered today. They have unique bundles for all of the full-fledged spelunkers of the Plot of Inquiry. Use Plot of Inquiry at checkout after registration. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see every one of them be deficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
Correct.
It's kind of like there's so many different interrelationships that, are going on. Like, what's the metabolic status of this patient? How are they sleeping? What's their neurotransmitters doing? There's so many different facets that you have to really look at.
Exactly right. That's
Yeah.
exactly right. And that's, within the regenerative literature, where you hear about how a lot of practitioners are now metabolically optimizing the patient, giving IV drips to get their levels up, their magnesium, their vitamin levels up prior to doing the PRP. Orthopedically, metabolically improving their overall BMI. All of those things come into this.
Right.
And so that's where the stellate ganglion, in my opinion, comes in also.
Yeah, and I think it could be a game changer, because a lot of these patients that will get to you, they've already had some of the stack, right? And this is just that one. It might be the tipping point that gets the other things that you were doing a little
Yeah.
bit more efficacious. So yeah,
Yes. Correct.
that's right. Now I got to ask you this question: do you think what do your colleagues think about you using D5? I mean, because this is very cutting edge. This is frontier stuff. This shows how you're on the cutting edge here, in my opinion. Because when I talk about the fact that we're doing, hydrodissections with D5 and perineural uh, infiltrations and stuff, they look at me like I just came in from another planet or something. It's
Yeah,
like, what?
correct.
What? Yeah. What are you doing?
Correct.
Yeah.
I think so. I I suppose what, there's dogma, and then
Hmm.
there is us, and so within the chronic pain anesthetic sphere, I don't think prolotherapy is really very high up in their radar. I don't think they look at it as an effective way of dealing with things. I think talking to other people is very difficult because you have prejudice, and being an interventional radiologist, I, the question comes, are you really a doctor doing what you're doing?
Right.
So I have to be a little bit mindful about that side of things. I don't. I mean, a lot of my stuff is anecdotal. I must say
Right.
that within my case cohort, I'm a working clinician, and I wish that I had a little bit more time to be able to present a lot of these cases and how I do things. That's
Right.
why I try and then give my real world experience on LinkedIn as a way of telling people what I do. Um, but equally, I think that you guys who do this a lot more will be the harbingers of change, if you know what I mean. I think that that's an important part of having these discussions and being able to bring it out initially within like-minded people and then put it out to the larger world.
Right. Well, there's a lot to be said about anecdotal studies and compilations of them. Everybody's hung up on evidence-based medicine, but anecdotal studies are evidence-based, and they may be studies of N of ones, but if you get enough of them, they start to add up, and they give you a tremendous amount of feedback in your clinical practice. I mean, obviously, you're not going to do something repeatedly if you don't have a beneficial effect for the patient.
Correct.
Yeah.
That's right.
And
That's right.
so, yeah, so I think it's kind of interesting because if you look in the literature, I mean, they've been doing glucopuncture for 40 years, maybe.
Yes.
South Korea's been, Europe's been, pretty prominent in it.
Yeah.
Um, but in the United States, I can't speak for Australia, but in the United States, people, I mean, this is so radically new that they're going, what are you doing? It's not, and the other thing is it's inexpensive.
Yes, correct. And same thing is borne out in Australia too. I have a feeling that we're probably about 10 years behind you guys in a lot of the regenerative sphere of things, and it may sound like we are archaic in certain areas, but I think that there's a conservatism in a lot of medicine that is hard to shake. I mean, we're not really touching the edges of stellate ganglion blocks. With 1% lignocaine, it's not mainstream, certainly not used within the psychiatric side of things. Um, and when you look at the 5% dextrose and the prolotherapy side of things, we're certainly within radiology, nobody knows what 5% dextrose is.
Right.
So it is very out there. Even within the chronic pain and orthopedic spheres of things, I don't think there's the very few practitioners who use 5% extra. It is very much in the family medicine sphere at the moment, and the musculoskeletal physician groups
Mm.
that 5% dextrose has been used. And so my colleagues here in Australia who have given me a lot of that information have also shaped a little bit of my practice too.
Yeah, it's kind of interesting how I mean, medicine is a big boat and it's really slow to turn. And,
That's right.
you know, it's, and when we first started doing this, I had great rapport with obviously these patients we would joke it's like, hey, let me try injecting you with some sugar water because we're out of snake oil today. So, but and they would they're good humor. And it's like all of a sudden they come back and they say, "Wow, I didn't think this would really work," but it's pretty cool to see that response for sure.
That's right. And the beauty of it is that you can make it yourself.
Well, yeah,
You don't have big pharma breathing down your neck.
right.
These are relatively cheap substances that are easily obtained that can be used with a lot of effectiveness,
Hmm.
and you can use it multiple times
Right.
um,
Well,
without having.
I think if you looked at how many injudicious steroid infiltrations there are, I
Correct.
mean, that's just,
Yep.
I mean, it just speaks for volumes for itself. The fact that you're using this agent that is very safe. I mean, the safety profile of D5W it's just
Yeah.
fantastic compared to other agents. And if you have a practitioner, regardless of what specialty, that knows what they're doing, where they're infiltrating, understands the anatomical orientations and that type of thing, I don't see how you could get any safer than using D5.
Yeah. Absolutely. And
So,
the other thing is that with the ultrasound probe, it's been a huge game changer too, because you now have targeted applications of D5W. The fact that we now use it in perineural infiltrations to
mhm.
relieve impingement, the results with carpal tunnel syndrome, with uh, other nerve impingements in the upper and lower limb, common perineal nerve, the anterolateral calf syndromes, the
Right.
rhomboid syndromes, all of these, they're huge, man.
I know.
Uh, they,
Are
that's changed everything. So at present, my practice is probably maybe about 10% steroid and 90%
non-steroidal.
non-steroidal.
Right.
Yeah.
Ah, that's fantastic. Are you familiar with Jan Kershot?
No. Oh, yes, I
Yeah.
do. I do talk to him
Yeah.
on LinkedIn. He's
Yeah.
also been a big driver in my practice.
Yeah. Yeah.
I've been loving his posts on glucopuncture and superficial glucopuncture. I
Right.
love the pictures that he puts up on where patients were given their glucopuncture and stuff like that.
Well, I've had him on the show twice,
Yep.
and I actually got to spend some time with him in his clinic over in Belgium. And
Yes.
I've developed a friendship with him. He's a wonderful man, and just what he's doing with this is phenomenal. I think his take on some of the fascial tensegrity and some of these things, and the fact that he does tremendous amounts of pain management just with subcutaneous administration, not even perineural.
Yes.
And
Yeah.
these folks, and I've seen them with my eyes,
Yeah.
in his clinic, and they're coming in, and it's like, yeah, um, they're all maybe I think I saw, I don't know, 10 patients, 15 patients with him, and all of them were repeat patients except one or two. And they'd all,
Yep.
yeah, no, I'm on my fifth treatment and I'm doing great and no side effects. And you know, he's he's getting things turned around that a lot of times, they've fallen through the cracks with all of these other
Yes.
different administrations and interventions, and then you come to like, well, it's just D5W. It's like,
Yeah,
you know,
absolutely. I mean,
but
the concept of biotensegrity is quite an interesting one, and it goes hand in hand with a lot of the hydrodissections that we're seeing. I think that's a whole additional layer in the chronic pain sphere that really is just being unpicked at the moment, but is getting really good results. I think that's an important part. Whether you take D5W or PRP or the platelet poor plasma,
Yeah.
it's been a big change in my practice again, understanding the whole fascial side of things and how fascia plays a huge role in the very act of producing chronic pain.
Well, it's real interesting. We're trained as surgeons that fascia is just this stuff that we have to cut through to get to what we need to do, and you never really think about it as an organ system, but it is an organ system. And
That's right.
the things that go on with it, it's fascinating. And it's another frontier that needs to be discovered, quite frankly.
That's true.
Yeah.
Going back to one of my cases that I talked about was this lady who had the post-radiation changes after thyroid cancer. She had a lot of radiation fibrosis, and one of the things that was part of this whole treatment process was releasing up the or hydrodissecting out the platysma and the fascial planes with 5% dextrose. And that really made a huge amount of improvement. So she had a number of broken capillaries on her skin, a lot of pigmentation, which was why I initially got involved from the venous side of things. And then as we started breaking up all these tissue planes, we started finding a very significant improvement in her quality of skin. Instead of everything getting stuck down, it now was glowing, was a lot more comfortable. Her dysesthesia, allodynia that she used to wear a scarf around her neck.
Right.
So that scarf came off because she could actually touch her skin now much more comfortably.
Right. And you know what? And when you put the D5 subcutaneously in that area where somebody has like horrible neuropathic burning, they will tell you why you're still infiltrating. Oh, it feels so good.
Yes.
It's almost instantaneous. It's like,
Genius.
yeah, it's phenomenal. Well, Amit, I got to ask you one more question before we wrap this up, and that is, would you come back so we can talk about venous? Because I think what you're doing with venous might have a big interest with our audience.
Oh, absolutely. Absolutely.
Awesome.
Veins are, there's a weird overlap, coincidental between chronic pain and venous stuff. And I think that there is quite a lot of interesting similarities between treatments between these two things. So yes, I'd love to have a chat about that side of things too.
Well, we'll set that up. I want to thank you for coming on the show. It's, I've done a couple podcasts now with folks from down under, and it's such a hard thing to get it scheduled because you're not even on the same day. Like you're in the future, man.
I know.
But it's crazy.
But I must say that a lot of what's going on with you guys is percolating down to us over here in Australia, and I think that despite the time zones and the distance, I think it's exceptionally important to keep that going.
Right.
Because I think at the moment we are having quite a lot of in my practice, certainly I'm having quite a lot of influence from what's going on in your part of the world, and I think that's I'm hoping that the chronic pain and the biologic side of things will keep on changing and keep on percolating down to us guys here. So I'd love to keep this connection going as long as possible.
Oh, I love that when you can you can have these conversations with somebody who's not in your backyard that knows, because then you get a different perspective and you actually learn a lot,
Yes, correct.
So I think that's fantastic. Amit, thanks so much for coming on. I think you're doing great work, and I really appreciate you taking the time. Thanks so much.
No worries. Thanks a lot.
All right.
Cheers.
As you know, I'm passionate about learning new ways to address health concerns. Moreover, before I recommend any treatment or supplement, I always try it on myself. Today, I want to share my experience with Troche. I have investigated other phytocannabinoid formulas and found that, in general, they were not consistent or reliable in their results. What impressed me about the Troche delivery technology is that each rapid-release tab is engineered to provide fast-acting, long-lasting, reliable delivery of phytocannabinoids to support your health and well-being. Many physicians understand the importance of using phytocannabinoids for physical discomfort, sleep issues, and mood. But if the formula is not reliable, most patients will give up, never experiencing the real benefits. I put this to the test on myself and actually tracked my progress. This graph shows my results for reducing stress. Troche is so serious about how well their product works, they partnered with People Science to provide the Troche Tracker health assessment application that lets you monitor your progress and works with you to accomplish your wellness goals. If you are a patient, click the link below and the patient button to register for Troche Tracker. Assess your baseline health metrics and receive a free Troche sample in addition to getting preferred patient pricing on all products. If you are a clinician interested in adding Troche to your practice, click the link below and then the clinician button to register for a wholesale affiliate account or go to the link above. I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.